As an EMT student, after you complete this chapter and related coursework, you will understand the significance and characteristics of general pharmacology, and you will be able to identify, describe, and demonstrate steps for assisting administering medications carried by the EMT. The National EMS Education Standards are very detailed here. For pharmacology, you will be able to apply fundamental knowledge of medications that an EMT may assist administer to a patient during an emergency. For principles of pharmacology, you will talk about and understand medication safety and the kinds of medications used during an emergency. Regarding medication administration, you will understand principles of self-administering medications, peer-administering medications, or assisting or administering medications to patients. For emergency medications, you need to know the names, the effects, the actions, the indications, the contraindications, the complications, the routes of administration, the side effects, and the interactions, as well as the dosages for any medications you may administer. Administering medications is serious business. Used appropriately, medications may alleviate pain and improve a patient's well-being. Used inappropriately, they may cause harm or even death. As an EMT, you will administer medications, help patients self-administer medications, ask patients about medication use and allergies, report patient information to hospital personnel, and if you do not understand how medications work, you place yourselves and your patients in danger. So how do medications work? Some definitions you may want to know. Pharmacology is the science of drugs, including their ingredients, preparation, uses, and actions on the body. A medication is a chemical substance used to prevent disease or relieve pain. Pharmacodynamics is the process by which medication works on the body. Receptors are located throughout the body. These are sites on cells where chemicals can bind and cause reactions. When medications are given, they bind to these sites and either stimulate the receptor sites and cause a reaction or block the sites and prevent other chemicals from attaching. A medication can either increase or decrease normal body function. An agonist is a medication that causes stimulation of receptors. An antagonist binds to receptors and blocks other medications. The amount of medication given is called the dose, and it depends on the patient's weight, the patient's age, and the desired action of the medication. The action is the therapeutic effect that a medication is expected to have on the body. Indications are reasons or conditions for which we give particular medications. Contraindications mean when a patient or a medication would either harm the patient or have no positive effect. Side effects are any actions of a medication other than the ones we desire. Some of them are unintended, and these are effects that are undesirable but pose little risk to the patient, and others are untoward effects which can be harmful to the patients. Medication names. The generic name is usually the original chemical name of a medication. Generic names are not capitalized. Some medications, for example nitroglycerins, are called by their generic names more often than their trade name. The trade name is the registered brand name that a manufacturer gives to a drug, for example, Tylenol or Lasix. Trade names begin with a capital letter, and one drug may have more than one trade name. Prescription drugs are distributed only by pharmacists and require a physician's order. Over-the-counter medications or drugs may be purchased directly without a prescription. Other kinds of drugs include street drugs like heroin and cocaine, herbal medications, enhancement drugs, and vitamin supplements. Any medication that a patient takes can be pharmacologically active and can cause an effect, so ask patients about any medications or drugs they are taking. Routes of administration. Enteral medications enter the body through the digestive system, often in pill or liquid form such as cough medicines. Parenteral medications enter the body by some other means, often in liquid form administered through needles or syringes. Absorption is the process by which medications travel through body tissues to the bloodstream. Some common routes of administration are per rectum or PR, which is given rectally, oral or per os, which is abbreviated PO, and that's by mouth. Rectal administration is often used with children. It's easy to administer and provides reliable absorption. It's also often used with medications for nausea and vomiting because of the digestive issues. PO enters through the digestive system, takes as long as an hour sometimes for absorption to occur. The pros are it's non-invasive and less expensive than parenteral routes, and the cons are it's unpredictable for absorption, and the absorption is affected by upset stomach or diarrhea. Intravenous or IV injection is into the vein. It's the fastest delivery, but we cannot use it for all medications. Intraosseous is into the bone, and this reaches the bloodstream through the bone marrow. It requires drilling a needle into the outer layer of bone. It is painful, often reserved for patients who are unconscious as a result of cardiac arrest or extreme shock. And it may be used for children who have less available or difficult access to IV sites. Subcutaneous, or beneath the skin, are injections given into the tissue between the skin and the muscle. Because there is less blood here than in the muscles, sub-Q medications generally absorb more slowly and have longer lasting effects. Some examples include insulin and some forms of epinephrine. Intramuscular injections are given into the muscle. These usually are absorbed quickly, but not all medications can be given this way. Some examples are the EpiPen or the Twinject autoinjector or the Mark I autoinjector. Some possible problems with IM injection are damage to muscle tissue and uneven, unreliable absorption, especially in people with decreased tissue perfusion or who are in shock. Inhalation is breathed into the lungs. It is absorbed very quickly into the bloodstream, and it minimizes the effects of the medication in other body tissues. Some forms are aerosols, fine powders, and sprays. Sublingual is given under the tongue. It enters through the oral mucosa under the tongue and is absorbed into the bloodstream within minutes. It's faster than the oral route and protects medications from chemicals in the digestive system. For example, acids that can weaken or inactivate them. Some examples for sublingual medication are nitroglycerin tablets or spray. Transcutaneous or transdermal administration is through the skin. It is applied as a patch and is longer lasting in effect than other routes. Some examples are nicotine patches or nitroglycerin patches. Intranasal is a relatively new format for the delivery of medication. Medication is pushed through a specialized atomizer device called a mucosal atomizer or a MAD. Liquid medication is turned into a spray and is administered in a nostril, and it's very quick to absorb, and Narcan is one of the medications that can be given this way. Medication routes are all listed here so that you have a very good idea of what you're dealing with in the EMS profession. So the rates are also listed here as to how quickly or slowly medication may be absorbed into the system. Medication forms. The form of a medication usually dictates the route. For example, a tablet or spray cannot be given through a needle. The manufacturer chooses the form to ensure that the route is proper, the timing of its release into the bloodstream is correct, and the effects on the target organs or body systems are correct. Basic forms of medications include tablets and capsules, solutions and suspensions, metered dose inhalers, topical medications, transcutaneous medications, gels or gases for inhalation. Tablets and capsules make up most medications given by mouth come in this form. Capsules are gelatin shells filled with powder or liquids. Tablets often contain other materials that are mixed with the medication and compressed. A medication that must be swallowed is less useful in an emergency because the digestive tract provides a slower delivery method. Solutions and suspensions. A solution is a liquid mixture of one or more substances that cannot be separated simply. Solutions can be given by almost any route. When given by mouth, solutions may be absorbed from the stomach fairly quickly because the medication is already dissolved. For example, the sublingual delivery of nitroglycerin spray. Many solutions can be given as an IV, IM, or sub-Q injection. A suspension is a mixture of finely ground particles that are distributed evenly through the liquid by shaking or stirring but do not dissolve. Suspensions separate if they stand or are filtered. It is important to shake or swirl a suspension before administering it to a patient. Usually administered by mouth, for example, antibiotics for pediatric patients or activated charcoal, which is used in EMS. Occasionally it's given rectally or applied directly to the skin like calamine lotion, and it may be given via IM or sub-Q injections such as hormone shots or vaccinations. Please watch this animation so you have a better understanding of how a suspension works. You can see here that the particles were in the bottom, and then they were mixed with the solution. The solute was mixed with the solution to form the suspension. Metered dose inhalers. Liquids or solids that are broken into small enough droplets or particles may be inhaled. The spray canister directs such substances through the mouth and into the lungs, and it delivers the same amount of medication each time you use it. Often these are used for respiratory illnesses such as asthma or emphysema.
As an emergency responder, you may need to administer medication to a patient with a bronchodilator metered dose inhaler, also referred to as an MDI. MDIs are miniature spray canisters used to dispense medication through the mouth and into the lungs. The medication helps open the airway.
Hello, sir. My name is Brandon. What seems to be the problem?
I don't know. I just become short of breath. I was mowing the lawn here. I don't know what happened.
Do you have any allergies to any medicines? You ever been to the hospital before?
Just for previous asthma attacks.
Okay, so you have a past medical history of asthma?
Yeah.
Okay, what was the last thing you had to eat?
I don't know. I had dinner probably a couple hours ago. I had a cheeseburger.
And I take it you were mowing grass before this all started?
Yep.
Okay, my partner's going to take your vitals here, and I'm going to give the hospital a call, see what we can do for you.
Okay.
Emergency Hospital, this is EMT Ward, Northwest EMS Medic 197. I have a 38-year-old male patient with possible asthma attack requesting permission to administer one dose albuterol.
Repeat the order given by the physician.
Okay, I'm going to administer one dose albuterol.
From the medication box, choose the correct medication as ordered by the physician. Inspect the medication label for the correct name and appropriate concentration. Verify that the expiration date has not passed. Actively shake the inhaler several times.
Okay, I have the albuterol here. This is going to help you breathe better. What I need you to do is take a deep breath and then exhale, and you're going to take another deep breath, and I'm going to give you a dose of this. And you're going to hold that breath as long as you comfortably can, and then exhale for me, okay?
Okay.
Okay.
Monitor the patient by reassessing vital signs, tissue color, and difficulty breathing to determine the effects of the medication.
Topical medications include lotions, creams, and ointments. They are applied to the skin surface and only affect that area. Lotions contain the most water and are absorbed very rapidly, while ointments contain the least water and are absorbed very slowly. Some examples for a lotion are calamine, and ointment would be neosporin. Transcutaneous medications are also referred to as transdermal medications. Unlike topical medications, which only affect an intended site, many transdermal medications have systemic or whole body effects. Some of the examples are nitroglycerin paste, adhesive patches that we see, like nitroglycerin, nicotine, and some pain medications and some contraceptives. If you touch the medication with your skin, you will absorb it just like the patient. Gels are semi-liquid and are administered in capsules or through plastic tubes. They usually have the consistency of paste or creams, but are transparent. Example would be oral glucose for patients with diabetes. Gases for inhalation are neither solid nor liquid and are usually delivered through a non-rebreather mask or a nasal cannula. Most often they are given in the operating room, and most common medication in gas form that is used outside of the OR is oxygen. Some general steps in medication administration. You only administer medications as an EMT with an order to do so for medical control. Now, this may come in the form of standing orders or protocols or online medical direction. Medical control may inform you to administer medications directly, offline, or online, via telephone or radio. You need to follow the 6 rights. The right patient. You need to ensure the patient who needs the medication is the person who receives the medication. The right medication. You need to verify the proper medication and prescription. You need to give the right dose. You want to verify the form and dose. You want to give it by the right route. You want to verify the route. You want to give it at the right time. You want to check the expiration date and condition of the medication and the right documentation. You always have to document your actions and how the patient responded to this medication administration. Your medic unit may carry oxygen, oral glucose, activated charcoal, aspirin, and epinephrine. Over the years, EMTs have been allowed increasingly responsibility to work with medications. Many departments have strict controls on when an EMT is allowed to administer a medication. These circumstances are peer-assisted. You administer medication to yourself or partner. Example, you were exposed to a toxic agent and need to use an antidote. These are typically in auto-injector form. Patient-assisted medication administration, where you assist the patient with administering his or her own medications. Some of the examples are nitroglycerin, EpiPen auto-injectors, or MDI bronchodilators. An EMT administered, where the EMT directly administered medication to the patient. The patient may be severely confused or unable to understand the need for the medication. Some of the examples are oxygen, oral glucose, and aspirin. It is important to understand that the medication itself does not necessarily dictate whether you will be assisting or actually administering. Medical control, state guidelines, and local protocols will be the determining factors that define your role as an EMT. And you refer to your local standards to obtain a listing of how and when EMTs can administer medications. Some of the medications used by EMTs. States, departments, and medical directors will define what medications are carried on your ambulance. The 2009 National EMS Education Standards recognize that some regions of the country may need their EMTs involved in the administration of additional medications besides oxygen, oral glucose, activated charcoal, aspirin, and epinephrine. Some of these examples include acetaminophen or Tylenol, ibuprofen or Motrin, and diphenhydramine or Benadryl. With oral medications, some of the considerations we face are the advantages are the ease of access and the comfort level, but the disadvantages are that the digestive tract can be easily affected by foods, stress, and illness. The speed of movement of food through the tract dramatically changes the speed of absorption, and activated charcoal is used most often as an oral medication because many poisonings involve overdoses taken by mouth. It keeps the drugs from being absorbed by the body by adsorption, which binds the drug to its surface. It's ground into a very fine powder to provide the greatest surface area for binding, and this is just like charcoal in your grill. It is frequently suspended with sorbitol, which is a sugar, and it has a laxative effect that causes the medication and the charcoal to move quickly through the digestive system. It is administered by mouth. It may be unappealing to patients, so you need to use a covered container and ask the patient to drink it through a straw. It may stain, so you should use protective clothing over your uniform, and you should protect your patient's clothing. You should not give it to patients who have an altered level of consciousness because of the risk of aspiration or have ingested an acid, an alkali, or a petroleum product. Just a good animation of how medications enter through the digestive system. Oral glucose is a sugar that cells use for energy, and it's necessary for your brain. Hypoglycemia is defined as extremely low blood glucose and can be caused by an excess of insulin. Oral glucose can counteract the effects of hypoglycemia. An EMT can give glucose only by mouth. It's available as a gel designed to be spread on the mucous membranes between the cheek and the gum. It's not as quick as injections for hospital personnel, AEMTs, and paramedics. And you should never administer oral medications to an unconscious patient or to one who is unable to swallow or protect their airway. Aspirin is an antipyretic. It reduces fever. It's also an analgesic, which reduces pain, and an anti-inflammatory, reducing inflammation. It inhibits platelet aggregation and clumping, which is useful during a potential heart attack. It is contraindicated in people who are sensitive or hypersensitive to aspirin, if you have pre-existing liver damage, bleeding disorders, and asthma, or in children during episodes of fever-causing illnesses. Sublingual medications. Some of the considerations. The advantages are they are easy to take or to talk with awake and alert patients and advise them to place a pill under their tongue. The head and face receive large amounts of blood flow, so absorption rates are relatively quick. The disadvantages are that any medication placed in the mouth requires constant evaluation of the patient's airway. You must also be alert to any signs of choking on the pill, and it should not be used if the patient is uncooperative or unconscious. Nitroglycerin is used for many cardiac patients, and they also may carry their own fast-acting nitroglycerin to relieve the pain of angina. It increases blood flow by relieving the spasms and causes arteries to dilate by relaxing muscles of coronary arteries and veins. It also relaxes veins through the body so that less blood is returned to the heart, decreasing the workload and blood pressure. Before administration, you need to check the patient's blood pressure. If the systolic blood pressure is less than 100 millimeters of mercury, you may have a harmful effect in administering nitroglycerin. Even a patient who has adequate blood pressure should sit or lie down with the head elevated before taking this medication to avoid the possibility of fainting. If a significant drop in blood pressure occurs and the patient feels dizzy or sick, lay the patient down and raise their legs. If nitroglycerin no longer brings relief to a person for whom it has previously worked, the person may be experiencing an MI instead of an angina attack. Ask how much nitroglycerin the patient needed in the past to relieve pain and how much was taken this time. Report this information to medical control. Nitroglycerin can have potentially fatal interactions with sildenafil or Viagra, tadalafil or Cialis, or vardenafil or Levitra. These are all meds for erectile dysfunction, or any other medication that is used for the treatment of ED within the previous 24 hours. It may cause a mild headache for your patient. What nitroglycerin does is it relaxes the muscular walls of coronary arteries and veins. It results in less blood returning to the heart. It decreases the blood pressure. It relaxes arteries throughout the body, and often does cause that mild headache after you administer it. If you administer nitroglycerin by tablet, you usually do this sublingually under the tongue, and it should dissolve. Patient should experience a slight tingling or burning. If not, the medication may have lost its potency because of aging or improper storage. Be sure to check the expiration date on the bottle. It should be stored in its original glass container with the cap screwed on tightly. What looks like cotton in the container is actually rayon. Real cotton in the container can absorb nitroglycerin, which would reduce its potency. Do not place any other medications in the container and avoid exposure to light, heat, or air. Note any drug storage concerns in the patient's medical history. If you administer by metered dose spray, it deposits the medication on or under the tongue. One spray is the equivalent of one tablet, and you do not use a spacer with the metered dose canister.
Some patients you treat may need medication administered orally or through the mouth. Medication taken orally enters the bloodstream through the digestive system. This process may take as long as 1 hour. Oral administration varies depending on the type of medication. Some pills are to be taken with water, others are paste or a liquid form called slurry. Be sure you read the instructions for each medication carefully before administering to a patient. Use appropriate body substance isolation precautions prior to beginning patient care.
Do you have any problems with this in the past? Yes, I have. What kind of medical history do you have?
I've had some chest pains before.
Okay. We're going to give you a little bit of oxygen to help take care of that shortness of breath. And my partner's going to get some vital signs. If you need, I'm going to give you a little bit of medication, okay?
Okay.
What's your first name?
Nick.
Nick. Okay. Nick, are you allergic to any medicine?
Not that I'm aware of.
Okay. You know what medicines that you take? You take some nitro?
Yes.
Do you have some with you?
No, I don't.
Okay. I want to give you some. Nick, if 0 is nothing and 10 is your worst pain, where would this be? be? Probably about a 5. About a 5? Okay. We're going to give you some of this medicine. This medicine may give you a headache. Okay, that's 100% normal, but I always like to forewarn my patients before they get it, okay? Here comes that oxygen. We're just going to put that on you right now. Just breathe in through your nose and out through your mouth. Nice and deep. See if we can't make that shortness of breath go away. Okay? We're going to get the vitals real quick, and we're going to give you some of this medicine so we can...
Inspect the medication label for the correct name and appropriate concentration. Check the fluid for clarity, discoloration, and obvious contamination, or signs of loss of sterility. Verify that the expiration date has not passed. Nitroglycerin should be placed under the patient's tongue. It comes in either a tablet or a spray. If you're using a tablet, have the patient keep it in place under the tongue until it is dissolved.
Okay. Put that on. Not the best tasting stuff in the world, but it does do a very good job.
Monitor the patient for the desired effects of medication administration by reassessing vital signs, skin color, or change in level of pain or consciousness. Document all changes whether they are beneficial or not.
Some of the administration considerations for both tablets and spray are to wait 5 minutes for response before repeating the dose. You should closely monitor the patient's vital signs, particularly their blood pressure. You only give repeated doses per medical control or your local protocols. You always should wear gloves because you can absorb nitroglycerin by your skin. If the patient is having chest pain, you may be able to apply oxygen, call medical control, or follow standing orders before helping to administer the patient's nitroglycerin. Know and understand what your local protocols are. Intramuscular medications. Some things to consider. The advantages are it provides quick and easy access to the circulatory system without the need for placing a needle within the vein. Blood flow to the muscles is relatively stable even during circumstances of severe illness or injury. The disadvantages are you have to use a needle and there is pain with it, and the patient may fear that pain or injury. Epinephrine or adrenaline is the main hormone that controls the body's fight or flight response. It is the primary medication an EMT will deliver intramuscularly. It is a sympathomimetic, which means it mimics the effect of the sympathetic nervous system. It is released inside the body when there is sudden stress, and it's also known as adrenaline. Its effects are that it increases the heart rate and constricts the blood vessels, causing an increase in blood pressure. It dilates the passages to the lungs, and it eases breathing problems in asthma or allergic reactions. It may maintain blood pressure in an allergic reaction. It should not be given to patients who have hypertension, are suffering from hypothermia, are experiencing a myocardial infarction, or are not wheezing, or have no signs of respiratory compromise or hypotension.
Some patients who suffer asthma attacks or have severe allergies to insect stings need to be injected with epinephrine as soon as possible. Use appropriate body substance isolation precautions prior to beginning patient care.
Are you allergic to anything?
Yeah, I'm allergic.
Epinephrine, also known as adrenaline, is the body's main hormone. Epinephrine is used to increase a person's heart rate and blood pressure, as well as to ease breathing problems caused by allergic reactions and asthma attacks.
You got sun by me? Yeah.
Patients susceptible to allergic reactions from insect stings often carry epinephrine auto-injectors. Inspect the medication label for the correct name and appropriate concentration. Your partner could be checking the patient's pulse while you're preparing to cleanse the injection site. Choose an injection site on the large muscle of the thigh. If time permits, cleanse the injection site to kill microbial agents that live on the patient's skin. In severe cases of anaphylaxis, it is acceptable to inject the epinephrine through the patient's pants. Place the black tip, the narrow end of the auto-injector, against the intended injection site. Push firmly and quickly until the needle is released and injects the medication into the patient. Remember, the needle sticking from the black end of the auto-injector is contaminated. Dispose of the auto-injector by inserting the entire device into a puncture-resistant sharps container, needle first.
As discussed in the video, it is permissible in some states for EMTs to administer epinephrine by injection or to assist patients with that. It is used to treat life-threatening anaphylaxis because of the insect venom or other allergens causing the body to release histamine. Histamines may reduce blood pressure, cause wheezing from bronchial spasms and swelling of the airway tissues, also known as edema, and make it difficult for the patient to breathe. Epinephrine acts as a specific antidote to histamine by constricting blood vessels, allowing blood pressure to rise, and reducing swelling, and dilating air passages to increase the flow of air. It may be dispensed from an auto-injector, and it automatically delivers a preset amount of the medication, usually 0.3 milligrams. Some of the side effects include causes a burning sensation where it is injected and increases the heart rate. Some services do not permit EMTs to carry epinephrine, but do allow them to assist patients in administering their own. EMTs may assist patients in administering epinephrine through their own MDIs for bronchospasm. Inhalation meds. All cells, especially those in the heart and brain, need oxygen to function properly. Oxygen should be administered when a patient is not breathing or is having trouble getting air. Generally, we administer this via a non-rebreathing mask at 10 to 15 liters per minute, which is the preferred method, which provides up to 90% fraction of inspired oxygen. Or we use a nasal cannula for patients who cannot tolerate a non-rebreather mask, and that gives oxygen at about 44% of inspired oxygen if it's set at 6 liters. It flows through 2 small tube-like prongs that fit into the patient's nose. You must ensure that there are no open flames, lit cigarettes, or sparks in the area in which you are administering oxygen. We also use MDIs and nebulizers. These are used to administer liquid medications that have been turned into a fine mist by a flow of air or oxygen. Medication is atomized, breathed into the lungs, and delivered to the alveoli. The advantages are that blood flow to the alveoli is very high, and the absorption rates are very close to those found with IV meds. It is fast and relatively easy to access this route, and it is commonly used because of convenience and portability. The disadvantages are that patients may need to be cooperative and control their breathing. It cannot be used in patients who are unconscious, and an EMT could use a nebulizer for more severe problems. Medications administered using an MDI. For respiratory conditions that are severe enough to require epinephrine, MDIs are more narrowly focused on the lungs. An MDI requires a great deal of coordination to administer. It may be difficult to achieve when a person is having trouble breathing. Patients must aim properly and spray just as they start to inhale. Using a spacer, which is an adapter, can avoid misdirection of the spray. Most of the medication sometimes ends up on the roof of the patient's mouth if you're not using the right technique. The spacer fits over the inhaler like a sleeve, and it has an opening for the inhaler at one end and a mouthpiece on the other end. The patient sprays the prescribed dose into the chamber and then breathes in and out of the mouthpiece until the mist is completely inhaled. Some of the trade names of asthma inhalers are Primatene Mist, Broniton Mist, Broncaid Mist, and Medihaler Epi. Beta-2 agonists are cousins of epinephrine that produce fewer side effects. They act more specifically than epinephrine on the bronchi of the lungs, causing dilation with a lesser effect on the heart. Some examples are metoprolol, which are also known as Alupent or Metoprel, albuterol, also known as Proventil or Ventolin, and albuterol is the most commonly used one in EMS. Patients may be prescribed many types of MDIs. There are at least 20 different ones on the market, and they may be prescribed 3 to 6 different individual medications. Some examples include corticosteroids, mucolytics, self-stabilizers, and the only medication that will be effective during an acute attack of shortness of breath will be short-action bronchodilators like albuterol. You should read the label of the MDI before you use it or assist your patient with its use. Patient assessment includes finding out medications your patient is currently taking. This information may provide vital clues to the patient's condition. It may help guide your treatment and may be extremely useful to the emergency department physician. It can help you determine a chronic or underlying condition when a patient is unable to relate his or her medical history. You should discover what the patient takes and transport the medications or a list of them with you to the emergency department. You should ask about any non-prescription drugs like over-the-counter herbal or illicit drugs. In summary, pharmacology is the science of drugs, including their ingredients, preparation, use, and actions on the body. Medication routes that we administer by, or that patients may administer by, are PR, which is perirectum, PO, which is per os or oral, IV, which is intravenous, IO, which is intraosseous, sub-Q, which is, or SQ or SC, which is subcutaneous, IM for intramuscular, inhalation, sublingual or SL, transcutaneous or transdermal, and intranasal or IN. Forms of medication include tablets and capsules, solutions and suspensions, metered dose inhalers, topical medications, transcutaneous or transdermal medications, gels, and gases for inhalation. One other thing to remember is the route of administration often determines the speed with which the medication takes effect. The administration of any medication requires approval by medical control through direct orders given online or standing orders that are part of the local protocols. You should be familiar with the 6 general steps of administering any medication, which are the rights of medication administration: the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. EMS units may carry several different medications, like activated charcoal, oral glucose, aspirin, epinephrine, and oxygen. It is also important to remember that after you administer medication, you need to reassess vital signs, reassess history, and do another assessment, treatment, and response findings. Knowing what medications a patient takes is important to provide vital clues about your patient's condition, to inform you of any chronic or underlying conditions, to guide your treatment, and for you to report to the emergency room physician.